Welcome to the Physical Activity Plan for Health peer call. I just heard a couple of beeps and I see some folks are still entering the webinar room. So this is Elizabeth Hardig from the Plan for Health project. And we have some folks who are on the line I see from Plan for Health Cohort 2 as well as Cohort 1 and a couple of Healthy Community Interest Group members, which is great. So if you're not familiar with the Plan for Health project, we have a wonderful website right there in the chat box, plan4health.us, with lots of great resources and more information about all of the coalitions who are participating in this project. And we'll also put a recording of this peer call on the website as well. All right, so today we are talking with Scott Ulrich from the Plan for Health project in Columbus, Ohio. So Scott was part of Cohort 1. They just wrapped up their work, I guess, at the end of May, so not too long ago. And Scott's going to be talking a little bit about his work on active transportation and a couple of their other physical activity strategies. So as you can see from the intro slide, Scott is the Healthy Places Program Director with the Columbus Public Health Department. And in this role, he works closely with other agencies on land use and transportation planning efforts. Scott also oversees programs that conduct walkability and bikeability assessments throughout the city of Columbus, and he provides technical assistance to developers on healthy community design. And of course, is a TA provider to Plan for Health as well. So I'm going to hand things over to you, Scott.
Can you hear me now?
Yes.
All right. Thanks, Elizabeth. And hello to everybody joining us on the call today. Thanks for joining. I'll just get started. Again, my name is Scott Ulrich, Healthy Places Coordinator at Columbus Public Health. I'm going to talk about some of the things we have done with our Plan for Health grant, but also some of the things we are already doing and how it all fits together, and particularly with respect to some of our trail projects, since it's July and it's National Parks and Recreation Month, and we want to celebrate that. So a little bit about our program called Healthy Places. It was created in 2006 in response to a mounting body of research showing that where you live has a profound impact on your health. And I think 10 years later, we have come a long way since then, when it was just starting to gain steam, and it's really great to see the Plan for Health project, a national organization like APA, pushing that forward with a lot of support from other national organizations and a lot of local grantees really taking that work and running with it. So our mission is to promote development practices and reduce negative health impacts, and to create places that foster physical activity in daily life. The program is staffed by urban planning and public health professionals working on place-based interventions to impact rates of chronic disease in our community and improve health equity. Now, at the time the program was created, we were one of very few that had this staffing structure, but today we see it more and more. In fact, the Ohio Department of Health now has their own Healthy Places coordinator who advocates for these same things both at the state level and in communities throughout Ohio. So it's really great to have that state level support now too. So before I get into some of our Plan for Health strategies, I wanted to talk about some of the things that we were already doing through the Healthy Places program before we got Plan for Health. Some of these were mentioned in the bio, but I'll just kind of briefly run through them. We do walkability assessments and walk audits with neighborhoods all across the city. And we use those walk audits not only to identify barriers, but also to identify the great places to walk in neighborhoods. And using that, we create neighborhood walking maps for each neighborhood that we do a walk audit to show them where the great places are to walk right now, because fixing the barriers that we identify could take years, and we want to get them walking right now. We have Walk with a Doc walking clubs in 4 locations throughout the city on the north, south, east, and west sides. And if you didn't know it, Walk with a Doc, the national organization, was actually founded here in Columbus, so that's we like to hang our hat on that. We do zoning and development review, where we review site plans to make recommendations on active design features that can be included and how those can be modified to be a little bit better for neighborhood health. We participate in the city's bicycle advisory group, planning bikeways, and educational campaigns and things like that for bicycle safety. We also participate on the bike share system planning steering committee, where that ranges from day-to-day operations, how the bike share system is run, to if we have 5 new stations we're going to install this year, where are we going to put them? What kind of payment plans we have to ensure that we are accessible to as many people as possible, but given the limitations we have. And then we've also done health impact assessment for a long time, although in the past it looked very very different from what we know health impact assessment is today, just because I think we were doing them before all the standards and things got adopted. We were doing very, very desktop, rapid style health impact assessments. And again, July is National Parks and Recreation Month, and we wanted to talk about some of our initiatives that blend parks and health. And this is one resource that I wanted to recommend from the Trust for Public Land called 8 Ways That Parks Improve Your Health. This particular excerpt on the right notes that parks and trails, I like to add trails when they say parks, are where people get the kind of exercise that their bodies need most. And while any physical activity is better than none, nothing builds fitness as well as exercise that raises the sweat and gets our hearts pumping. And parks are actually where much of that type of exercise occurs. According to one study, about 12% of moderate exercise takes place in parks, but for vigorous exercise, the proportion actually goes up to 50%. So we know that parks are vital places for people to get healthy. So now going into some of our Plan for Health strategies. Central Ohio Greenways, we like to call them COG, has been around for more than a decade and has managed to build more than 180 miles of trails in Central Ohio, which are traveled more than 13 million miles by its users annually. And we know that trails provide value to their communities. They increase access to destinations. They produce positive economic impacts. They attract and retain talent, and we know that they contribute to the health and vitality of the region. So we decided to double down on this work. And COG has gone from a very informal group of park planners and trail advocates into a formalized board structure with true cross-sector representation from businesses, development community, healthcare community, and nonprofits. And it's all housed under MORPC, which is our regional MPO. And we used Plan for Health funding to leverage additional dollars to conduct a strategic planning process to prioritize action items and set goals for the next 5 or so years for COG. In our recent Columbus Parks Master Plan, a survey indicated that trails were the #1 most liked feature, but also the #1 facility people said we needed more of. And in a separate survey of specifically for trail users, connectivity rose to the top of both questions: what's the best thing about Central Ohio trails, and what's the one improvement needed for Central Ohio trails? Both said connectivity. So the way I interpret that, from my knowledge of the trail network, is that once you're on the trail, the connectivity is great, but getting to the trail needs to be a better experience. And that's further reinforced by the fact that that data also indicated that almost half of the people who were surveyed on the trails had driven to those trails. So we definitely need better connections to our trails so that people don't have to drive there. That economic impact of trail study was conducted in 2015, and again, it showed that users travel more than 12 million miles on the trail network annually. There's a high satisfaction, but people want more of them. And we found that businesses really value trails as an amenity for the local economy. So to set the path for the next 5 years, MORPC led a strategic planning process to develop an action plan for the board. So we researched other trail organizations around the country to identify best practices in trail development, programming, marketing, and fundraising. We developed a new vision and mission statement for the board, including sort of an elevator speech so that we can clearly and consistently share our story with all the types of audiences in our region and across the state and the country. It'll create measurable and obtainable objectives for trail development, fundraising, education and programming, and building partnerships. And it was all kind of building on the key messages that were developed through that economic impact of trail study. Let's see. The COG board also expanded their focus area for trail development from just sort of Franklin County, which is that image on the top, which is really it's the county that Columbus is housed in, out to a 7-county region encompassing most of Central Ohio. And we expanded this focus area because it includes all the counties that has the state's largest trail, the Ohio to Erie Trail, as well as counties that have active trail plans and trail development going on. We wanted to pull the region together to make sure that anything going on, even on the fringe, ultimately has the intent of connecting up with the rest of the system. And this area can expand over time as needed. We're also looking to assess the value of the trail system. So we want to extend that economic impact study that we did in 2015 to update it with new measures, but also include new measures like health and integrate that into a true value assessment of what the trails mean for our community, not just from an economic impact, but from health impacts and things like that. And we're also updating the brand guidelines and marketing materials so that wherever you are in Central Ohio, you are telling a consistent story about the COG network. You are clearly conveying to users that you are on the COG network, so we can be just consistent and stand together in this effort. So that's all for the Central Ohio Greenways. Some of the other initiatives that we're doing, that we had, they're still doing some of them, but I guess I can say we were doing for Plan4Health. So our new thoroughfare plan is called Connect Columbus, and this is one of the ones that's still underway. We're creating new street design manuals, new performance metrics that evaluate level of service for all users, assigning priority levels for different travel modes and different corridors, and developing access management guidelines to improve safety along key corridors. And we're conducting a health impact assessment. So that was our piece of it. We're not actively working on the plan itself. We're doing the health impact assessment, and that's been our involvement in the plan. And through that HIA, first and foremost, we want to maximize opportunities to improve the environment for walking, biking, and transit in order to increase the amount of physical activity that people are able to integrate into their daily lives. We also want to make sure that we're making investments that will minimize some of the side effects of motor vehicle traffic, such as air pollution and crash-related injuries and deaths. And in this way, we're trying to integrate Vision Zero principles into the metrics for the plan. We also want to make sure that people have good multimodal access to destinations that impact their health directly, such as schools, parks, and healthy food sources. And we're integrating our recently completed district-wide school travel plan into the Connect Columbus plan. So we're trying to apply the same thoughts of safe routes to school, to safe routes to parks, safe routes to food, safe routes to any kind of healthy place that we want to make sure people need to get to. And finally, we're making sure that equity is considered in the planning process by identifying neighborhoods with the highest concentrations of vulnerable neighborhoods and making sure that that's one of the criteria that's used to prioritize transportation investments in our community. And since I mentioned safe routes to parks, I thought I'd point out a couple other resources if you're interested in safe routes to parks in your community. These are two resources. One is from APA on the right, and one is from NRPA, the National Recreation and Parks Association. Both of them have really good resources for pursuing safe routes to parks. Another initiative we were doing is called Bike-Friendly Businesses, and this has continued beyond the Plan4Health project period as well. This is now just one of the programs we do. But we basically realized that to get the bicycling mode share up, it takes more than just changing our streets. It means there has to be end-of-trip facilities that support biking at workplaces. It means having policies that support biking at those workplaces, like offering incentives such as free bike share memberships for employees. It means having amenities like bike parking, showers, and locker rooms to overcome some of the common barriers that prevent people from biking to work. So we began engaging businesses around town about how they can be more bike-friendly, how it can help their bottom line from happier and more productive employees, to lower healthcare and transportation costs, to stronger employee recruitment and retainment rates. And to help other businesses see what it looks like to be a bike-friendly business, Columbus Public Health decided to lead by example, and we were the first ones, once we started pursuing this program, to be recognized as a silver-level bike-friendly business by the League of American Bicyclists. And we found that when awards like this are given, it makes people ask, oh, well, we got silver, what do we have to do to get gold or platinum? So that's been a really good program for us. And Safe Routes to School, another initiative we did for Plan4Health and are continuing to do. We're doing things like walking school buses, where parents act like the bus driver, but walking along a predetermined route and picking up students along the way until they get to school. Bike rodeos, where we teach students how to ride a bike safely. We're helping acquire bike racks for schools that don't currently have them, and integrating biking and walking topics into the physical education curriculums. And obviously we can't do this ourselves at all 95 Columbus City schools, elementary and middle schools. It requires a lot of help from parents and teachers and volunteers. One solution we found is to use high school students as Safe Routes to School mentors and ambassadors, since they have community service requirements that this helps them meet. But one of the most important things we've done through this is slowly build meaningful relationships with school administrators. Those in charge of the transportation policies, facility management, wellness initiatives, those are the ones that can institutionalize Safe Routes to School principles into the processes that are already happening at the district level and that we otherwise couldn't impact. And lastly, this was not a Plan4Health initiative, but I wanted to share it anyways to go along with the Parks and Recreation Month. This is one more parks partnership that we've been working on. And it on the left is actually another one of the pages from 8 ways that parks improve your health. These are Trust for Public Land fitness zones that are special areas of parks set aside for free outdoor exercise equipment. And on the right, we have the ones that we've installed in Columbus. We call them fitness stations. We don't want to impinge on any registered trademarks or anything that the Trust for Public Land has. You know, we put this in about 3 parks already, and they've been really successful. We get a lot of positive feedback on them, and these have all been installed in health vulnerable neighborhoods, and each one has been installed next to the playground in that park so that parents can work out while they watch their kids. So these are just great, and obviously they look great in photos, but they are really just great equipment and have had really positive impacts on the parks that we've installed them in. But otherwise, that's it. I wanted to leave plenty of time for discussion and Q&A, so I'll leave that to Elizabeth to sort of facilitate.
Sure. Great. Thank you, Scott. That was a fabulous overview of Plan4Health, and it's exciting to hear about the fitness spots or fitness stations. That's really great. So if you are on the line, you're welcome to unmute your phone and ask a question directly to Scott, or you could chat a question through the chat box on the right-hand side of your screen. Either way is fine. And maybe while folks are thinking of some questions and kind of digesting all of the great work that you all have done, could you maybe step back and talk a little bit about the coalition itself? So it's housed in the health department, right?
Yeah, so our coalition, it's called the Columbus Chronic Disease Prevention Advisory Board. It's sort of a mashup of a couple different coalitions that already existed when we started this process. And, we had a couple different coalitions that existed for specific grant purposes, and we realized, these are all chronic disease grants. They're all chronic disease related coalitions. So we just combined them into one big chronic disease prevention advisory board. And there are subtopics within that, but we felt it was important to get all those people talking to each other, not just the physical activity folks and not just the food access folks and not just the tobacco people, but making sure that we all know that we all have the same priorities, and you're not just in one of those buckets, and we all have something to learn from each other. And it doesn't make sense for some of the same people to sit on all these different coalitions. We can all sit around one. But it's been really great. We have a lot of different sectors represented, and I think it's been a good change. I think people are still getting used to it. I think we're continuously assessing how we can do things differently. And we haven't quite settled on something that we like, but I think people are are having fun with all the change that's happening. And it's nice. So not just the physical activity versus food versus tobacco folks, but people who are on the policy end of the spectrum and the PSE, the policy system environment kind of work, around the same table as the people doing programming kind of work. That was one of the really big things that started happening, was people who've been in the programming game for so long that they don't see PSE as being part of what they do, and that may well be, but we started to see connections between how we could support each other, making sure that even though we might be doing PSE and you might be doing programming, we can be supporting each other in the same work. So as an example, the Bike Friendly Business Program, we were going after businesses to seek policy changes, to implement environment changes in their workplace, and that kind of thing. And then Yay Bikes, which is our local bike advocacy group, was actually doing programming level work with the employees. Actually, any of the employees who were interested in biking to work, they would meet them at their front door, design a route for them, for if they weren't sure where they might ride on their way to work. So that was a good example of us doing PSC and them doing programming, but it was all within the same with the same goal. Yeah.
That's great. And I have to say, connectivity is a theme for everything you do in Columbus. I mean, from the PSC and programming conversation you just shared, or example you just shared, to thinking about connecting the Columbus City network, rail or trail network, to the region. I think that's it's been fabulous to watch that unfold through Plan4Health and know that it's continuing beyond. So we do have one question from Chad, who's asking about the best ways to measure active transportation in cities, which is a tough one.
That's a tough one, and that's something that we really struggled with on the HIA, to try and, because it's a really hard one to answer. We didn't even really have the level of baseline information that we wanted to have for active transportation. The easiest thing to access is obviously the census data, the American Community Survey data, but really that only tells you commuting. It doesn't tell you where people are riding for every other trip they're taking, whether it's to school or to get groceries or anything like that. So we haven't found an answer. We've found a lot of proxies, but there's no perfect solution. And then trying to estimate, the changes in that travel behavior based on what's being proposed in the Connect Columbus plan, so that we can estimate the health impacts of the increasing, so say you install a bike lane or a new sidewalk or a new trail, what is that going to have an impact on in terms of the number of people walking and biking and taking transit? that baseline information is what it stems from, and until we get, I think it's the lack of information has really kick-started a lot of conversations around, what can we do to have better data available, and those conversations are still ongoing. And so I don't have a good answer for you other than get that conversation rolling in your community so that places like your MPO who are already gathering some of that information for their travel models can potentially integrate it into some of the travel surveys that are happening. I know right now the state of Ohio is modifying the travel survey that they use, which then trickles down to all the MPOs, and that has been we see that as a big opportunity for a new data source that'll not only give us great data to use, but it'll add a new metric that the MPOs weren't really using before. They had great data for motor vehicles, but they just had not much data at all for where people were going and how many people were going by foot and by bike.
Mm-hmm. Yeah, we've heard the data question from lots of the Plan4Health coalitions in both cohorts, and I think you're absolutely right, Scott, that getting a sense of the baseline is so important to demonstrate impact and change. And it's tough when you're thinking at the city level versus maybe trying to pinpoint a potential change in one intersection or making the case for a connection between one neighborhood to a trail system. And I think kind of the level that you're working at is also makes a huge difference. I know the team in the other Columbus, Indiana, they were really focusing on redesigning a couple of key intersections, and they were able to benefit from a commitment that the city made that everyone will be within 3 blocks of a trail connection to a park. And so having that goal coming from the city really helped them to focus on a couple of key intersections and have conversations around a particular place. But getting a broader sense of a city, especially a city as large as Columbus, is definitely challenging.
Yeah, I know through our trail system, though, we have really ramped up the data collection in terms of automated counters that are permanently installed along the trails. So we're getting consistent trail counts now, which is really great. Unfortunately, we can't distinguish between walkers and bikers on the trail, but it's still something. And then so we can now look at before and after a key connection is made. So if you have a segmented trail in 2014 and then you put in that key connection and you can compare before and after numbers to see what that does to increase the amount of people using that trail when you can actually get from point A to point B now, we can now take and estimate future key connections, what that potential impact could be. So that has been a really good development, just trail counters. But again, that's just a snapshot that doesn't tell you anything about how many people are on the streets, but it's something. Yeah.
Right. Interesting. Thank you. So we just have a moment or two left. Any other questions? Feel free to chat them in or to ask over the phone line. I did want to say go ahead.
Scott, I know you did show the fitness stations and you talked about your trails and having the counters. Now, what about stations in terms for bicycles? Like, do you guys have things there on the trails that people can, pump up their tires or if something were to happen? There's small stations like that throughout the trail?
Yeah, we have that at some locations along the trails, probably more locations on the streets where we have bike corrals and we have fix-it stations installed along with them. We're always dealing with them getting vandalized or broken, but it's still a good amenity to have out there. We're right now under construction of our first, we're calling it a trail hub. It's not just it's along the trail. It's a shelter house, bathrooms, water bottle filling station, bike racks, fix-it station, everything you might need If you're doing, since it's along the Ohio to Erie Trail, and you can travel from Cleveland to Cincinnati on that, and we're halfway in between, it's supposed, hopefully one of many more to come like it, that are basically it's a trail station, yeah, like you mentioned. But yeah, we have little amenities like that scattered throughout. No current, comprehensive strategy on where to put them, but I think that's one of the priorities for the trail development group with the COG. The COG board is not just where we need to build more trails, but how do we add more amenities and enhancements to the trails we already have. So, and not just things like that, but placemaking and development around trails, and how do we build community around trails is a big priority, at least of mine, in bringing that to the COG board.
Okay, thank you.
That's great. Thank you. All right. Well, we are just at the end of our half hour. So thank you so much, Scott. This was a fabulous presentation and lots of wonderful resources and information. And as I said, we have recorded the session. We'll post the slides and the recording on our website. And Scott has left his contact information. You're always welcome to reach out to Scott, and I'll go ahead and put my email address in the chat box. If you have any questions about other Plan4Health projects or resources from APA, I'm happy to help. So thank you all for attending, and thank you, Scott, for sharing.
Thank you.